care coordination, super essential. Let's talk about why, but let's also talk about the biggest challenges that organizations face when trying to coordinate care across multiple specialties and settings.
I feel like I can say a lot of challenges. I know, Colette, we've even worked together on some of these things. One of the biggest challenges, too, is this fragmented data across multiple EHR systems with different providers. With that, it's really hard to have a clear, straightforward workflow. And we know manual workflows really don't scale. Staff burnout is real, especially on that care manager side. So those are definite challenges that care management is up against often.
Yeah, definitely. And to add to that, I believe that also changing the clinical approach per specialty is also a challenge where we have vascular patients we have to handle different than our endocrinology patients and nephrology. There's a lot of different clinical workflows that to think of it manually it takes a lot of time, where as we're coming into platforms like ThoroughCare and once we're thinking more about AI, the automation techniques that are starting to come out is really helpful in areas.
I think technology is going to be vital in really supporting that scale. People, we know while there's the shortage on one end, we also know the aging population is continuing to age and there's going to be that demand. So it seems like it's now even more imperative than ever that you have a platform to really enable your team to do what they need to do, to reduce kind of the manual workflows. We know we want to report on outcomes, so being able to easily do so, all of those things, definitely there needs to be a focus on it.
Yeah, I think at the root of value-based care, we're talking about a couple of things: reducing avoidable spend and improving quality. Care management, taking care of the patient, has to be a team sport. If you have the care managers focused on some of the quality issues, making sure that patients or high-risk patients are identified, they're seen, labs are done, medications reconciled, follow-ups are scheduled for physician visits. All that leads to that improved quality and hopefully eliminates the disasters that can happen in between those visits, so you reduce spend. From a financial perspective, I think it's important too, because we are reducing those avoidable ED visits. We are reducing those avoidable hospital admissions. And those are the costliest parts of what goes into, some of the costliest parts of what goes into that spend every day. So in value-based care, we're going to have a better chance of achieving shared savings. We're going to save money, overall spend, and we're going to improve quality in those patients' lives.